Yes. Before we get into the program proper, I would like us to entrust the entire program into the hands of Jehovah God Almighty.
Thank you for gathering these women. My Lord and my God, we thank you more especially for the organizers. You are the God who directs. Papa, for there is nothing that is hidden. You are the one who gives wisdom. Papa, for each and every speaker today, Lord, that you give them knowledge. Papa, you put words of utterance in their mouth. Lord, we believe and trust in you. Papa, for we know with you all things are possible. That is why we call upon you. That in each and every soul, Papa, that is connected today, that will not go back the same.
Please permit me to introduce you to Mrs. Laura Tinzo, our able vision bearer.
Great things happen when strong women come together. So you all are amazing, strong women, and great things are definitely going to happen in this place today. It's a wonderful thing. I don't take it for granted. We don't take it for granted. 6 years ago, when God gave me the idea to start this meeting for women, I didn't know what exactly it was going to be or what impact it was going to have on anyone. It's been a journey, but I am so grateful to God that He has always placed people, other women on my path who have taken my hand to continue this journey, because we have been moving together. And let us just open our hearts, let us just stay positive and trust the process and believe in what God is going to do for each and every one of us today. We say thank you. I'm going to just leave this place now and sit down, because I am here today to learn, to listen and to learn.
She is a professional and a certified psychiatrist based in New Jersey, USA. Basically, she actually did her medical studies here in Germany, in my city, in my current city here in Heidelberg. And that is where she met her husband, who happens to be my brother. So she is my sister-in-law. Yes, she is my sister-in-law, a very dear one indeed. She is a mother of two beautiful girls. She is very passionate about the mental well-being of everyone she comes across. That is why she always seizes the opportunity that comes her way to educate us, to give us tips on how to go about these mental health issues that is plaguing our community every day, especially given this time of COVID. So I would just like you all to welcome her, to give her a hand of applause. Just give that clap on screen, yes. Our keynote speaker, Dr. Dilys.
Thank you so much, Auntie Ben, for this wonderful introduction. Again, I just want to welcome everyone. And I really hope that, we will have an interactive session. I'm super excited to be here and to talk with you about this very, very important topic, stress and mental health. And without further ado, I will go ahead and share my screen so we can talk. Okay, I'm the host. Share my screen so that you can see what I prepared and we can have this conversation here. All right. Let me see. Can you all see my screen? Is it shared?
Yes, we can. Yes, it's shared.
Yes, we can.
Yes.
All right. So I'll go straight right to it. Please, your questions, we have time for questions and answers. So just keep them at the end of the session and I will be more than happy to talk with you. And if we run out of time, you are more than welcome to send an email or to contact me. I'm on Facebook, or go through the organizers and I'll be happy to give you a professional response. So the objective of our talk is just to understand the basic definition of stress, mental health, what that means, and to understand the neurobiology of stress. I feel this is important so that we can understand why people react to stress differently. and also to understand how we can identify stress-related symptoms in ourselves, in our loved ones, and also to think and understand some positive coping techniques that we can use, that we can implement when we are going through stressful situations or when we find ourselves exhibiting these symptoms that are stress-related. And the end, just talking about management and treatment options. I'm sorry, most of you guys are in Europe and I'm not so familiarized with what type of resources are available, but I think we can infer from what is available here, most likely they must be out there in our community, so we can reach out and get help. So my next slide is just financial disclosure. I have no financial relationship to disclose. I am currently a fellow at SUNY Downstate in New York, Brooklyn. I am by no means giving this talk in relation to my training facility. This is just me as a person. All right, so let's go on to it. So what is mental health? You know, you hear people talking about mental health. What is it? So mental health, it includes our emotional, look at that word, emotional, psychological, social well-being. Just to say a little bit more about that. Most people, they're like, what do you mean to be like, I'm healthy? We would normally say when you're healthy, it's because you're not sick or you don't have any illness. But no, being healthy means you're being in a state of well-being. And that well-being includes emotional, psychological, social, financial, interpersonal. So basically you have all these aspects in your life. That's why you hear people saying you need a balance. You need this balance to be able to be healthy, to have a good well-being. And these affect how we think. So stress is not like, okay, it also modifies how we think, how we feel, and how we act. So if you look at that, our behavior is directly related to stress because of stress, we behave in certain pattern that is normally out of our norm, how we would normally behave. And it also helps determine how we handle stress. If you are not in a good mental state of mind, your reaction to stress will be totally different compared to someone who has a stable, well-balanced mental health. And also, as I said, how we relate to others. So it affects our interpersonal relationships and the choices that we make. And if there is a disturbance, we will have problems in these different areas of functioning, of cognitive functioning, of our mood, of our thinking, and of our behaviors. So the next slide is just defining stress. What is stress? We hear everyone talking about stress. So a stress is a state of our mental or emotional strain or tension. And what is it resulting from? Adversity, right? From what life throws at us. So adverse or demanding circumstances. If you look again, it is a feeling of emotional or physical tension. And it can come from any event, right? And what is peculiar about stress is that it evokes in us an emotion. And my next slide, I will just touch base what is emotion. What is it that when people say emotions, what are our emotions? There are some core emotions that I would just like us to be familiarized with. And again, stress is your body's reaction to any challenge or demand. So moving on to the next slide, what are emotions? So emotions is like your reaction to what is thrown at you. And your emotions is very, very important because your emotion actually controls your thought process and it controls your behavior. So if you look at the core emotions, when things happen to us that are rewarding, we are happy, we express joy. When things happen to us that, it's on the receiving end of a punishment, then we are sad. And on the other hand, look at what stress does to us. It makes us to express this emotion of fear and anger. And I will go more on the next slide to tell you what fear and anger actually does to your body in the neurobiological aspect of it. And it may you have some insight, some understanding your reaction to stress and how detrimental it is to your overall well-being. And just that you heard about it, as we're talking a lot about emotions, these are several core emotions. Some people can extrapolate and make more emotions out of it. You can see 10, but basically when you ask you, how do you feel inside? So how do you feel inside is your mood. And then your emotion is how you react to that mood. So either there is joy, there is fear, there's anger, there's disgust, there's sadness, there's contempt, there's surprise. So these are all like emotions that you express based on what you are taking in, right? All right. So now let's understand the neurobiology of stress. So we talk about stress. Now, basically, I throw in this slide because I really want us to understand why, you will see people are exposed to the same adversity. Like people have the same stress. What am I even talking about? We're in a pandemic and people react differently to pandemic. And that even being said, people can have, different stressors related to the pandemic. But let me even put a situation where everyone is faced with the same adversity, with the same stress. You will realize that people react to it totally differently. And I'm saying this because it's very important so that we can have empathy and we can relate to other people who are reacting to an adversity that we find, I don't understand, like, what's the point? This is something that you should just brush over. But you have to understand we are all very different, starting from our biological being and also our psychological. So biological beings, from biological perspective, so I like us to look at human beings and in these 4 main categories. There might be more, but for the sake of time and this presentation, I'll focus on these main 4. So clinical, neurochemical, that's your neurotransmitters in your person, neuroendocrine, and the ultimate, your genes, your genetic, right? Your predisposition. This is not something that this is how you were made. Your parents passed this over to you. And also psychological. Psychological in this aspect is what you experience, right? Your childhood, if there were any adversities, if there was abuse and neglect, and how it kind of like plays a huge role in your future as an adult, as you're aging, and in the decision you make and in how you even think and you process information. So I think the next slide, I broke it down, what biology is. This slide looks a little bit busy, but I'll explain it to you guys. So when you're saying that we're understanding biological, I want you to understand that from the clinical aspect. So your clinical traits, people are different. And traits are what you're born with. They are born with, but they can be modified as you age with time based on how you accept your life experiences. So you have some people are impulsive. They are just from nature impulsive, and from children, or sometimes, they learn to be impulsive as a defense mechanism. Why I'm saying that is that somebody who is impulsive and is faced with any type of, adversity or life danger, the way they will react to it will be way different from somebody who isn't. And the same thing with aggression and neuroticism and hopelessness. There are people, when they are faced with any stress, they see always the dark side of it. Like regardless, like things can never get better. And with that mindset, they are more prone, they are more likely to get into a depressed state or to have overall an adverse effect on their mental health. Going to the neurochemicals. Neurochemicals, if you look at it, these are neurotransmitters that our body has, and even in this concept that we use to treat people who have depression, anxiety, because, clinical research have shown that they either have, a shortage, right? They have a decreased amount that you're supplementing with medication or whatever technique, or, they don't just produce enough, or going to my last point, genetic, they are predisposed that they have some mutation or polymorphism that, these hormones or these neurotransmitters are not acting the way they should. What I'm saying that the main 3 neurochemicals that we use, and we also use in pharmacology to treat mental health illness, especially depression, anxiety, post-traumatic stress disorder, is serotonin, norepinephrine, and dopamine. Most of the antidepressants are enhancing one of these 3 neurotransmitters. SSRIs, maybe you guys know it, citalopram, Zoloft, they're all serotonin. And then you have the SNRIs, the serotonin, norepinephrine receptor blockers. You have like Cymbalta, duloxetine, you have Effexor, and then you have the dopamine. Something like Wellbutrin is norepinephrine and dopamine enhancing. So those are your neurotransmitters. You could have shortage, you could have a lot. So this is something that, they are different in each of us as individuals. And then we have the neuroendocrine system. The neuroendocrine system, even before I go that, just look to the right of my slide. I just put in this basically not because of the structure in itself, but just that you have an idea what are the functions of this neurotransmitter, what they do. If you look at it on the left, you see the dopamine pathways. There are different pathways. I don't want to go into details there. That will be a whole hour on itself. But again, just look at it, the function, what it does to us as a human being. So dopamine is our reward, motivation, our pleasure, euphoria. So imagine if you have a shortage, if you don't have enough, how you feel. It will be the opposite of these things, right? Motor function, it helps with fine-tuning, our compulsion, our perseveration. And then on the right side, you see the serotonin pathways. Serotonin is our happy hormone. It helps with our mood, with our memory. It helps to process information, sleep, cognition. So it just tells you as a human, we need these neurotransmitters. And when they are short, then we tend to have symptoms that are showing that our mental health is dysregulated. And in this sense, either anxiety or depression. All right, now we'll go to the neuroendocrine. Neuroendocrine is, I don't know how much biology you guys to remember, and those who are professional here, is basically the pathway that leads to the production of cortisol. That's what it is. Cortisol is your stress hormone. Stress hormone sometimes is good to a limited extent because it helps you prepare for, I don't know, an exam. Imagine if you have an exam, you need a little bit of stress that can make you maybe focus more or to put your attention to where you need to put it. But again, when it becomes excessive or when it becomes chronic over years because of trauma, it just sets up your mind, your brain is just set up that the little bit of stress, adversity that comes your way, you are already, expressing all of these neurotransmitters, and it is just detrimental because your body is in a constant state of stress. You have all these hormones, and it definitely, it's not good. It's not good for you. But again, some people, they cannot help it because growing up, they went through so much trauma that they are constantly in a state of panic and stress that anything that adds up to it is just like, what we say in Cameroon, the last stroke that break the camel's back, like they just decompensate. They cannot help it. But again, if you keep that in mind, you can have some understanding why people react to stress the way they do. And last but not the least are genetic. That's actually the most important. Because as I already mentioned, our genes are who we are, and they can be mutation or polymorphism starting from, right from the DNA itself. So from the genes, and then from the receptors in your brain that are supposed to process these neurotransmitters, and then again, even to the neurotransmitters itself. There are people who have serotonin, but they are non-functional. So just keeping that in mind. So that will tell us, will help us to understand how people react to stress differently. Moving on to the next slide. Okay, let me speak it short. Okay, so the next slide is how to identify stress-related symptoms. Funny enough, most people who are going through stress, they might just say, oh, I'm stressed right now, or some people might identify. Most people actually, they do not. And there are the people around them that notice it because of the way they are behaving. They're behaving out of their norm. All right. So for us to notify, to identify if we're going through something very stressful, if it's a short duration of time, then we can easily bounce back. But if it's stress that is chronic and it's ongoing, like this COVID, if somebody lost their job, they lost loved ones, and this pandemic keeps going, you can notice by seeing how your sleep pattern is. Sleep is very important. It's restorative to the brain. If you start noticing on sleep disturbance, either you have difficulty falling asleep because your mind is racing, you're thinking, or you realize that you wake up at night multiple times and it's difficult to fall back asleep. And overall, you feel like you are having these hours, but you feel tired. You don't feel rested in the morning. And then to other people, including myself, is the social isolation. You don't have any interest to go out with people because you don't have any interest. And anhedonia means lack of interest in pleasurable activities that were pleasurable before. So you isolate yourself. You're not enjoying things that you used to enjoy. And then you have a decrease in your energy level. You feel fatigue, right? Feeling numb or like nothing matters, like you don't care anymore. Or you have unexplained somatic complaints, body complaints, aches, pain. And this is a really a difficult one. Feelings of helplessness. Helplessness is okay because you might be looking for where you will get help, but hopelessness, that's the one that is the killer. It's equivalent to depression when we're evaluating people for suicidal ideations. Hopelessness is a huge one. And worthlessness. Worthlessness is, I'll talk more on the next slide, but worthlessness is when most attributed to like depression or depressed state, when you feel you're not good enough. Like you feel like everyone else is what being here but you. And it's a very bad state of mind to be in because it drives away any motivation to do anything for yourself. Any self-advocating thought or behavior, it just kills it. And then another one is engaging in substance use. And the most common substance is alcohol or cigarette, if somebody was smoking before. Those are the step drugs to real big gun substance use, alcohol and cigarettes, because they are legally permitted and allowed and accessible. You'll see a lot of professionals as well that they start drinking a lot. They're drinking every night when they come back from home because this is the only thing is sedating that kind of calms them and takes them off, whatever it is that they were occupying their mind with. So that's a warning sign. Just notice if you're drinking more than you would normally drink. And then you're feeling unusually confused, forgetful, on the edge, angry, upset, worried, or even scared. And sometimes some people notice because they just become more irritable. They're fighting, they're yelling with family members. And they experience severe mood swings, right? They easily can blow off the handle. 1 minute they're okay. And having persistent thoughts and memory that can't get out of your head. That's another one. You keep ruminating. That's what we call it. Or perseverating for somebody who cannot shift the thought to another thought. But ruminating is when you go over the same thing over and over. And I bet you, the more you're going over it, the more the emotions that are being evoked are more negative. And you're in this spiral, and then your negative emotion is affecting your behavior. Maybe you won't take a shower. Maybe you won't go out to visit a friend. Maybe you won't make that phone call. So kind of like a vicious cycle. And then the worst one, and I said the worst one is when you have thoughts to harm yourself. Because that is what we are trying to prevent the most by picking up the symptoms before it gets so bad. Because when it is there, I know there is this no suicide movement, and that's what we really pray and we hope. But sometimes when somebody is at that stage where they're thinking and they're planning and they're plotting on how to kill themselves, it takes just one tiny impulsive move and then it's too late. So that's another big one. And please, if anyone is having those thoughts, is no taboo here. Mental health is no biases. I mean, researchers, studies have proven that there are some changes going on in the brain, as I just highlighted before in the previous slide. It is actually a somatic problem. We talk about mental health, your brain is a muscle, and there are changes in the brain as a result of mental health. Please reach out for help. Reach out for help. Talk to a friend. That friend will probably talk to someone and they can send someone to your home for a wellness check. Talk to your siblings. I've had patients who have spoken to me that I was at that point, and then I had a phone call from my friend, and she said something, just something trivial, just something that they did together, and they laughed, and then it went away. It takes just that moment, just to be kind, to receive kindness, and also to interact with other people to save lives, right? And then you'll find that's the ultimate definition of any psychiatric disorder, when there is an impairment in functioning in all your areas of functioning, be it academic, social, interpersonal. So if your inability to perform your daily tasks, that means it has reached a state where you are not functioning anymore, right? So that is when, we will actually attach a disorder to what you're going. It's not stress anymore. Okay, so the next slide. I put this one here. So when people come in when they say, okay, stress, and now they're depressed, what is it that we clinically would say somebody has a major depressive disorder? Like, what are the criteria? Was that a question? Okay. All right, moving on. What are the criteria for depressive disorder? So when somebody has depression or somebody is feeling depressed, we have to separate when somebody is just having, depressive symptoms, right? And you see that a lot in adults, older adults, 65 years and older, that they do have some prodroma. We call it just prodroma symptoms of depression, but they do not meet the criteria. They don't meet the full criteria for a full-blown major depressive disorder. But these are the symptoms that we evaluate patients when they come in. And either it is stress-induced or, they are just inherently, like biologically, they have predisposed and they've been having depression. It starts with the mood. We say depressed mood. We say more days often than not in a week period. So you can say in a week, 7 days, maybe 4 or 5 days during that week that they feel depressed, they are unable to talk themselves out of that depressive state, and they are unable to function. So it has to be so intense, but that will be like severe depression. It could be mild too, that somebody has depression. And then, sometimes there are different subtypes of depression. Sometimes reactive, somebody brings them or shares good news with them. Then they get happy for that moment, and then they go back to being depressed. Regardless, your mood is more depressed than not within a 2-week period, right? 2 weeks is a minimum. And they have decrease in pleasure or activity. That's what we also call anhedonia. And then some people, when it's significant, they can have weight loss. Some people eat more when they are stressed. So you can also have weight gain, atypical depression. Sometimes they cannot sleep or they are oversleeping, right? And then there's this psychomotor agitation. That's when you're fidgeting, you're being restless, or retardation when you're just doing nothing, you're stuporous. And then there is also feelings of worthlessness and a diminished ability to think, and recurrent thoughts of death. That's when it really gets bad, it's suicidal. And I see this kind of similar. And for us to diagnose you with a major depressive disorder, you need to have five out of these 9 symptoms. So 5 out of 9 and meets criteria for DSM-5 and major depressive disorder. Okay. So our brain, right? I just want us to understand like our brain function. We are human beings because we have these abilities that other animals do not have, and we call that our cognitive capacity. A cognitive capacity of the brain is divided, like we just said, there are 6 main core cognition or cognitive capacity that we evaluate every time in humans. And if 2 or more of them, there is an impairment in 2 or more of them, that's when you can start diagnosing somebody with cognitive impairment or dementia, like in that aspect. So your brain as a human being, all of us here, we're able to talk. So you have language, right? And then we are able to sustain attention. So we have attention. And then we have a memory, which can be broken down to, short-term memory, long-term memory. You can still break it down to procedural memory, like driving a car, a bicycle, you don't forget certain things, or, and then a memory, you have a visuospatial. So you are able to see things in different dimensions. You're able to draw a wall clock, you see the clock, you are able to produce it, to draw it again. And then you have your executive functioning, which is your working memory. So you are able to, calculate, do math, plan. So stuff like that. That's just things that a human being, our brain is able to do. And if you look at it, when it is affected by mental illness, look at it. It affects different aspects of how we function. It affects your thinking. Imagine you're thinking, that you're kind of like not knowing what is real, what is not real. Like you are on a verge where you are unable to discern what is actually happening, what's just your thought. Very confusing, especially with people with severe mental illness like schizophrenia. And then even your perception, right? So you can see somebody standing there and you're just smiling, and then you're like, this person is talking about me. Yeah, now, what is this evoking in you? Emotions. You're angry, you're upset, you want to attack. So it affects your perception. You hear voices that are not there. You see things that are not there. That's all your perception that can be affected by mental illness. And then your emotions, we talked about emotions, signaling your physical, and of course, your behavior. So physical is these somatic symptoms I talked about, body ache, pain, you feel tired. All right. So what do we know about mental illness? I really love this slide because this slide is what is going to break our biases and stigma, hopefully. when people talk about mental illness and we talk constantly and we raise awareness, and hopefully, maybe not this generation, I pray that people can start seeing mental illness the same as they see physical ailments, physical illness, because the bottom line is it is just the same. So most people live a productive life and positive life while they're receiving treatment for their mental illness. And some people have severe and persistent ones. So we have to acknowledge that one, right? There's some people that, their mental illness is so severe that they cannot function. Those are people that were institutionalized before, and now, they are every family member, like every family will have one person that they will be like, I don't think he's mentally okay, because he doesn't do anything out of his life. Like whatever you try, they will never ever succeed, just because they don't have that cognitive capability to be able to do it. You don't just see them and you see that. Like it doesn't show in their phenotype, in their face, that they talk like we do, they act like we do, but they are just not capable of making something big, of processing, planning, and accomplishing anything. So again, mental illness, this is a good one. It does not respect boundaries, right? Every race, in short, every human being, right? There's stress or geography. Everybody is open, is liable to have a mental illness. And it has nothing to do with intelligence. I mean, I can tell you guys, the more people who are in a position where they have a lot of responsibility, they are the highest ones who are at risk for mental illness, stress-related illness, because they make these changes. There's all these changes in hormonal activities in their body that they don't have control over. And again, it can happen to anyone, right? And it is chronic, but it is not contagious. I should have even put it here that, there is a cure for it. I think I put it there. There is a cure for it. There really is a cure for it, so long as you seek help. And cure doesn't mean taking it away. Cure means that you are able to function. Because at the end of the day, that's why we're here on earth. We have a purpose, and we want to fulfill that purpose. So we want to function. Anything that comes in the way from us functioning, and in a sense, in the form of mental illness, it's something that we should be able to manage. We can live with it, but we are still functioning and we are still attaining and achieving our goals. So next slide. Recovery mindset. This is for all of us, including myself. I talked about stigma earlier, but I'm still putting it there. That whatever stress you are going to, why I'm saying, because stress is a condition, we established that already, but we saw that it also affects our mental health and our mindset. And when it does, if you don't have that positive mindset to get out of it, no matter what everybody does to you, it's not going to help. I think you guys are all aware that there are people that they take placebo. Placebo means that it's a pill that has nothing in there that is supposed to be therapeutic. Like it's just a pill that's rubbish or whatever is in there. There are people who take it and they recover, they heal from severe medical conditions, even mental health conditions, to tell you that your mind is very positive. Your mind is very positive and plays a big role in your overall well-being. If you can overcome that stigma and say, okay, I'm Dr. Dilys Ngu, I'm a psychiatrist, I'm a fellow, I can never have depression. If I have that mindset, then I'm setting myself out for failure. So we have to overcome that stigma and be aware and know that, if I have these symptoms, I need to seek help. I need to manage them. So we have to manage our symptoms. We have to assume control. So we should be our number one advocate. We should be the ones to go out and seek that help. Nobody can seek that help for you. And you want to be empowered, because through you, so other people will be empowered, and they will see that, when you're vocal about it, they'll see that she went through depression and now she's doing okay. I can go ask her, my sister, when you were depressed, you were telling me about it. How come that you're feeling a lot better? And she will tell you, I'm talking with the therapist every week. I take this medication. I saw this doctor. So those are things that we should be sharing. We should be talking. It's the same thing, right? Somebody had a surgery and they say, this surgeon is the best. You will see people, which surgeon did you go to, to get this surgical procedure done? Because my mom or myself needs something similar. So this is the mindset we should be approaching with mental illness. Overcome that stigma, that bias. I mean, in the professional realm, there is nothing that is a taboo. Let me put it that way. There is nothing that is a taboo. Okay. Now, what are your positive coping skills in our community? Like, what should we do? Getting professional help when indicated. Most of the time you don't. If your friends are telling you you are not behaving yourself, if at the workplace you are being called constantly because you are forgetful, there are errors, your performance is declining, they are not just talking, okay? Those are red flags. Take that seriously and ask yourself, but wait, hold on a minute. And maybe when you talk with a professional, they can guide you and direct you to see where, the stress is coming from, or if you are already having a mental illness, take it seriously. That's the bottom line. Social interaction. Human beings, we are social beings. If you isolate yourself, you are missing out, and your body is going to fight against you. Like you need to connect with others. That's the bottom line. There must be one or two people in your life that you trust to share your things with. There is no way you can keep things to yourself. It will erupt and then you will be impulsive, and when it explodes, you won't have control over your behavior or what you will do next. So, and then another thing is try to stay positive. No matter what life adversities throws at you. I mean, if you are still here, you are still alive, it means that you were able to overcome a lot in the past, and you have that tendency and that power, that tenacity in you to keep moving on. And again, you have to constantly remind yourself, you are here, we are all here for a purpose. And then another thing too that people tend to neglect, including myself during this pandemic, is getting physically active. When you are physically active, you are with yourself and your mind and your body. It's very important because you get to think about yourself. Hopefully, you are not ruminating. You're thinking about, self-reflection, what you've achieved, what you've not achieved, your goals you're getting with. And at the same time, you're keeping your body, you're keeping your mind very fit. and then helping others. There is a lot people gain out of helping others. Like that euphoria, like that dopamine rush that goes in knowing that you save somebody or you help somebody. We all need it. Like we can say we don't, but we really do. And most important, getting enough sleep. You need sleep for your brain to rest, for you to regenerate. And then you need, or I didn't put there, healthy eating. Mind diet, Mediterranean diet, whole grains, vegetables, fish, blueberries, strawberries, nuts, walnuts, cashew nuts. Those are very nutritive for the brain. Okay, so the next slide. Positive mental health allows people to, I just said this already, you realize your full potential, you cope with stresses in life, you can cope positively, you work productively, you make meaningful contributions to the community. Let me see how good am I with time here. Okay. And then my next slide basically is like just treatment of depression. I know, and although I did say that we should try to avoid biases and stigma, that is still hard. Most people who have no experience with mental health, it'll be difficult for them to make that phone call or to walk into that office and say, hey, I'm not feeling well. There are other ways that you can go about it if it's not that severe or if it's something new that you're dealing with. The one that I find that most people are acceptable to take or to do is therapy. Most people, they don't like to take medication. I don't know, there's a lot of stigma with it in different cultures. But regardless, psychotherapy. Talking with a professional is way better than talking with your friends or your sibling. But again, talking with your friends or your sibling is way better than talking to nobody at all. So we will encourage talking with someone who cares about you, who can understand you on an emotional level. I've seen that it helps, it goes a long way to have that emotional support. But it even goes a notch up when you talk with a therapist. Because a therapist is like most people, they don't understand that it is your time, it is your space. Like, you can just be as vulnerable and talk about anything you want to talk about because, hey, you are not being judged, right? Nobody is judging you. Nobody's pointing fingers. And the therapist is not telling you what you should do or what you shouldn't do. They don't know either. They're just human beings like you. But they are saying things from different perspectives that you cannot see it. And they can slowly bring it to your realization that, okay, there is this pattern that I constantly do. What will happen if I break that pattern? And you can try to break that pattern and you will see that the results will be different. So that's it. So psychotherapy and research, evidence-based, that the changes that it does in your brain, right, in the neurobiological level, is the same compared to medication, pharmacotherapy. It is the same. So somebody who has depression with some therapy is having adequate treatment. Somebody who has depression with some medication is having adequate treatment. However, if the depression is so severe, therapy is not good enough. Like therapy, you need more. And we've known and we've seen that a combination of psychotherapy and pharmacotherapy works the best. You can't top it. So that combination it works the best. And then there are these new modalities. They're not that new anymore. That came out. ECT has been here for a while, electroconvulsive therapy. And then recently they added TMS, transcranial magnetic stimulation therapy. Those are therapy that you're going directly physically. You're going to the brain and then you're trying to stimulate it and allow your brain to release all of these neurochemicals we talked about, norepinephrine, serotonin, dopamine. And through that, you're trying to increase the concentration in your brain and change the relationship of this neurotransmitter and the receptor. You want to change it because what happens to your brain is if you have shortage for so long, it's just natural. Your brain produces more receptors because they want to pick up any of the neurotransmitter that is available because they little the one that they want to grab it. And when it's like that for a while, then it goes back in a negative loop. And then you are just in that chronic state. You want your brain to go back to degenerate those receptors and just have the enough amount that is needed for you to function with a good mood, with a good normal well-being. And then body-mind medicine. I just had 30 minutes time, like mindfulness. There's some nice videos that you can just YouTube, like on mindfulness, meditation, breathing techniques. Very good, very helpful. If you look at the remarks that people leave, they're like, this is the best 10 minutes I just had today. You know, it's very relaxing. And it's just basically helping you to focus on your being. You know, we walk around. If you take a moment and just appreciate your hands that you use to write, or your legs that walks you all over the place, or, you know, your breath that you've been breathing and you are alive. So mindfulness is like just blocking out all this external noise and just focusing on your body. And most of the time, they want you to focus on your breathing because that's something that you are doing all right? You breathe consciously and you can actually focus on it. As like some people say, if you're taking a deep breath, take it slowly, you keep it in, and then you breathe out slowly. So you're actually, you are in the presence, like you are experiencing the breathing in and the breathing out. And it's relaxing. And for us physicians, most of the time in the hospital, we're always trained. And if it's overwhelming and they're calling you left and right and the phone is ringing and you are just in the middle corner of it, you just take a moment. I go to the hallway. I just put my head on the wall and I'm taking a deep breath in. Just keep the breath and then I breathe it out. I just do 5 times. I encourage us to do 20 times, but 5 times, I bet you. It's like you reset your mind and you're like, okay, now you can prioritize what is more emergent, what should I take care of first and the next. Like it just helps you, gives you a break in the day to move on. All right. And my last slide, again, I was just touching more on this therapy that we talked about, the different modalities of therapy. You have the behavioral therapy. That's it's normally very brief, sometimes 12 sessions. This therapy, basically, as I said, the primary goal is for you to understand and you to change your behavior. So they're trying to, there is this concept that, they said, your behavior, that your emotions, your thoughts, right? The way you think, the way you process things cannot affect your emotions. And then your emotions affects your behavior is the triad that they normally try to do. And it's difficult to change somebody's emotion. It's difficult to change somebody's thought, but you can change somebody's behavior, right? So that's where you try to get into that loop and evict and cause a change. So you go to the behavior and you encourage people in their behavior. Like we call them, sometimes people are, you do it bit by bit, graded tasks. Bit by bit, like I'm overwhelmed. My house is cluttered. I don't feel like doing anything. I'm procrastinating. I have all these bills to pay, and you just feel overwhelmed and you shut down. So somebody like that, you're like, okay, let's start from one tiny angle. So the first thing I'll study, what is more pressing? Oh, I have to respond to these emails. All right, so let's start at that email. So I challenge you that when next I see you, you would have responded to 2 or 3 emails that is most pressing for you. So you're trying to change the behavior, but by reducing the behavior, that is going to give some sense of relief. And biological, we talked about it, right? We talked about medication. Biological is all about medications, different medications for depression, for anxiety, for mental illness. And then psychosocial, that's the situations around you. There's another big movement that is coming up now, and it's called a social determinants of health. Doctors have realized that you can do everything well when somebody's in the hospital or somebody comes in and complains of anxiety and depression. But if you do not take into consideration your social aspect, how they are living, what is going on with them, then you are missing the point, because you can treat them, you can give them the medication, but if whatever is out there that is inducing the stress, that is causing the stress, and you don't try to modify it, you're wasting your time. It's just you are wasting your time, because the stress is still coming, there is chronic and it's still coming, and the medication is just you're chasing your shadows. Let me put it that way. So most people, if somebody comes and tell you I'm homeless, I don't have a place to live, I sleep at the Bahnhof, at the train station. I'm very anxious every day when I sleep there. And you are the provider, and you are not looking out to see if there's any resources, homeless shelter, or try to talk with social worker, get that support to provide help for this patient. What medicine is going to get rid of that anxiety? It's very obvious. If he's sleeping at the train station, he is anxious. So there are certain things, other aspects in humans like that. When somebody comes in and tells you, oh, my sister, I am depressed, I lost my job. And the best thing you can do for that person is to look for a way that the person can get a job. Or if you see any connection or anything out there that you can help that person, you stand up for that person, than to just say, oh no, it will be okay. How is it going to be okay if the person is having financial stressors, the person is not working? So there are certain aspects in our social, our environment that kind of make us to have, to behave or to have some kind of mental condition that cannot just go away with medication. Therapy can help, because therapy can help that person to see other avenues where they can seek out for help. But medication, again, I said you are chasing shadows or clouds. And then, of course, interactive is when you use all multiple models together. And psychoanalytic is going back deep, going back into your past, into your childhood, and trying to identify situations that happened that make you see, or you see life in a certain perspective or in a certain way, and then you react in that certain way to try to see if I think the purpose of psychoanalytic is that if you are able to go back and you can identify, or you can realize that this is what happened, and from then I have this certain pattern of thought, that's the therapy, that's the treatment. If you can realize, then you can evoke change. If I tell you, it doesn't mean anything. You should be able to recognize it yourself. It takes sessions, is what you sit on the couch. Even the psychoanalysts themselves, they have to undergo psychoanalysis on themselves for 5 years. It's a very intense kind of like treatment, but it's very helpful. Like people who've done it, they should have this psychoanalytic state of mind. They should be able to hold and contain certain emotions, because there are certain things that we don't like to talk about because it evokes anxiety, it evokes fear, and we don't want to go there. So yeah, let me see. And that's it for my talk. So references, I'm a psychiatrist. I use my UpToDate, my daily life. I use some of our main textbooks. I use DSM-5. And thank you all so much for listening to me. So I'll stop sharing at this point.
Thank you very much, Andine. Words cannot express our appreciation. The talk has been so informative and educative. A lot of people have put comments on how educative it is, how informative it is, and how beautiful it is. The way you break it down to our understanding is just awesome. So thank you very much, Andine. We appreciate you, Dr. Dilys. Dr. Dilys Ngu, thank you very much.
I had a question for my sister who just shared. It's regarding reaching out to the people, the nearest, whom we feel we're fully trustworthy or this. But sometimes it backfires. They themselves turn the tables on you, go out babbling about you and telling things about you. And that breaks up your trust and it gives you more pain. And I have come across many people like this. That's why I cut short my circle and I don't disclose many things because sometimes it backfires. So I want to know what is the other way out, sister.
Thank you so much for bringing that to informing all of us about that, because that is so true. And I guess that's why I said somebody that you can emotionally relate to. It's not everybody who can handle, mental stress. Sometimes, you are sharing whatever you're going through, and the person who you're sharing to is unable to handle it. It's too much. It's overwhelming for them. So that's why I think the first gateway that I would recommend is maybe talking with your primary care doctor. Talking with your primary care doctor and say, hey, I've been going through a lot and I feel like it's affecting me. I won't go to my friends if you've been, beaten in the past or you had a past or an experience that was just terrible. Because at the end of the day, people like hot gossip. Like they'll be like, oh, can you imagine she's going through that? That's why it's always nice to have somebody that you trust, that you think that they can handle it, or somebody who is going through something similar. If you don't have that, that's okay. Start with your primary care doctor. When you go, you can just schedule an appointment and say, hey, I've never seen a psychiatrist before. I don't even know if it's something that needs a psychiatrist, but this is what I am going through. And I don't know if, you want to refer me or what to do with it. Like, this is what I'm going through. What am I going to do with it? I also hope that out there's the movement of mental health, that, your primary care will be like, okay, maybe you need to speak with a therapist and they can give you the phone number. And most therapists, they understand because most people don't use therapy, and they can just start talking with you and then try seeing, what is it that is causing you or giving you this much stress or this much pain. And then they can work with you on how to go about it. Again, therapy is just trying to see things from different perspectives. So you don't see yourself the victim, or you see yourself the assaulter, whatever position where you see yourself. So you are just able to move on. Did that answer your question?
Yes, sister. Thank you very much.
The president of a grassroots non-profit organization that has to deal with a lot of widows and women from the crisis zone. I remember last week I received a woman whom I asked her name, and she's so lost that she could not remember her own name. And I those are things I don't have any prior professional knowledge about, even how to be able to address this issue. So today I've learned a lot. Asking the woman, what's your name? And she can't remember her name. I've understood that this is something really mental and has to do with a lot of stress in the brain. But now our reality back home is this, and that's what I want to ask the doctor this afternoon. Many of us back home are not aware that what we actually are going through is a mental issue or it's a stress issue. We are not aware. And even when we try to, or somebody tries to caution that maybe you're going through this issue, it's a mental issue, we are in denial, in complete denial of the fact that it has to do with some some things that are running in the brain or in the mind. Because we are always looking at the witchcraft side of issues. We're always looking at somebody's trying to bewitch us or somebody to witch us and so on. And secondly, once people realize that there's an issue, bam, the first thing they do is run to church. I don't have any issue with people running to church. I'm a Christian, born again for that matter. But I believe that there's always two sides to our living. There's a spiritual and a physical. And from all what you've learned today, it means that there's something I have to do, which is actually entitled to me. I have to do it. Nobody has to do it for me. It's not prayer that has to do it. Like the breathing technique. I don't need prayer to do the breathing technique. I didn't know about that before. Now, doctor, how do we caution people, or how can I caution myself to understand and accept that not all issues that might be even mental or stressful are spiritual, that I have to help my own self or talk to another lady that, look, what you're going through is mental or spiritual. Secondly, we don't even know where to seek help back home. I personally, with all my knowledge, I cannot tell you or point you to somebody who is a doctor in that domain or a counselor in that domain. How do I help my people at the level of the grassroots?
Thank you for this, two great questions. So the first one is, you know what, I'll answer your second question first. Where you can get help, right, back home.
Yes.
One thing that we do when we are talking to people, especially in the US, I'll call the US is because it's multicultural. We have people from Asia, we have people from South Africa, we have people from Africa, we have people from everywhere. A lot of different cultural and ethnic groups, people together. Where I practice, I think 50% of my people are from Jamaica or they're from the Caribbean. And believe me, that's where witchcraft is very common. It's very rampant. It's a belief that, they practice. Same as in Africa. What I'm trying to say is that you meet people where they are. So in Cameroon, for example, depression and psychiatrists, they are not everywhere, or that's where I'm from. So I'm talking about Cameroon because that's where I experienced, that's where I grew up. Psychiatrists, I would never ever heard even a psychiatrist growing up, and I've wanted to do medicine since I was 5 years old. My dad, who is a physician in himself, he had a hard time understanding when I told him I'm going to do psychiatry. But he has practiced and he has retired back in Cameroon, and he did not even understand what psychiatry is. And I had to explain to him many times what it is. Mm-hmm. That's a physician that has practiced for over 40 years. What I'm saying is that we make do with what we have available. And then we slowly try to create awareness in our community. We are the youth of Cameroon. The kids growing up now, this awareness, talking about it, at some point, it will become, at least people must have heard about it. Maybe not understand, but it's not still a myth that, did not even exist. When I was growing up, I never heard about mental illness. I never knew somebody was abused, what they were going through, whatever. It was just like, they should deal with it. Like, it wasn't even something that was being taught in the schools or anything. I will recommend that because most people, they do church counseling as well. Church counseling, not spiritually, but for mentally. Not only going there to pray. I know that some people like my mom, she's an elder in the church, and she does a lot of mental counseling sessions in Tambulu, in Bamenda. I would assume that other churches have been, enlightening, and they're producing this counseling session to support people going through a lot of mental health problems or a lot of stress. So I would think that will be an avenue where you can go and talk to your pastor and say, hey, I'm dealing with a lot. I feel I'm depressed or whatever. There should be one person that can even sit with you and say, hey, what is it? And see avenue where they can support you. Secondly, the level of social support that we have back home is I don't know, like I haven't been back home in a while. It's almost 6 years now, 7 years now. But I feel like back home, people care about you, at least to a certain extent. Here, you can die in your home and people can discover your body a week later. In back home, I think it's very unlikely. There must be one person who will say, hey, I've not seen her leave our home, I will go to check on you. That being said, most women, or they're in your jangi groups or their meeting groups or certain group, that is kind of helps also mitigate certain type of symptoms because they have to go and play their jangi, for example, so they cannot be home. They are out there associating. They might meet one person that might make them laugh. Without that person, they might not have laughed for an entire month. I've seen somebody here who told me he hasn't smiled for 2 months. Like there was no reason to smile. He has not interacted with anybody for 2 months because of that social isolation. That I pray and I hope that we don't really have that to that extent back home, because it's a culture where, everyone is involved, everyone is in there. So I'm hoping that, in Cameroon or in any other African country or in any other places where they don't have access to mental health professionals, that they have access to a certain degree of somebody that can even meet them at that emotional level, and they can talk about what they are going through. And then going back to your first question was spiritual. That when you approach it, everybody's like, oh, straight to the church, let's pray about it. Spiritual aspect of it is as important, but again, it's not the only cure of it, but it's important. I think that's the only thing that they know. And if you are having a problem and everybody's like, let's pray on it. And sometimes people feel frustrated, but they will be like, oh, I've been praying, I've sowed my seed, I've been praying, this is years and things, I still haven't gotten that job, or I still am standing at the same place. So it is there. I think still approach it with respect, because the person who is offering the prayers is the best that he can do, or she can do. It's not like they know more and they are withholding from you. That's the best that they think they can offer you. Again, going back to you taking that autonomy, that advocacy, that educating yourself and knowing that is one aspect of it, but I need more. So it's all about education. Just hoping that, one day they'll start talking about mental health in the schools and in the universities, so that we just all educate ourselves. Because I don't know more to say unless somebody has something else to add.
Anyway, I think we are going to come to the open discussion session where people could actually add something that they feel it's necessary or give their own personal experiences.
What are your thoughts on social support, peer support, self-help groups, since there is limited access to mental health resources? I'm in the US and there's, I've been doing advocacy work for mental health and economic distress for a few years now. And with policymakers, been working to try to improve policy that helps with unemployment rate, especially in African American and other vulnerable communities, since racism has been the number one issue as to why we have high unemployment rates. And I've gotten a lot of drawback from nonprofit organizations who have been laying in bed with the Federal Reserve, which affects that monetary policy. National organizations, the local ones here, have literally tried to stop my work to hold the Federal Reserve accountable on how their monetary policy is causing economic distress. Mental distress, well, due to the economic situation that we've been dealing with. And so one of the avenues that I've been looking into and getting training on is programs for us to have our own peer support groups. Of course, that would also entail possibly having resources available for unemployed people, housing, food, all the other basic necessities. I did a research through a local university and as a fellow on economic distress and mental health of unemployed African American mothers and their children. And the significance of the study showed that African American mothers with 2 or more children showed most or major signs of mental health warning signs and symptoms. And so I know it's something that we have to resolve. It's not our fault that we're Black and have to suffer from high unemployment, high rates of single parenthood. And so there needs to be an avenue for us to have some kind of relief. And if it's not policymakers, if it's not nonprofit organizations like United Way and community action agencies, which are at 97% of the counties in the US, and they're not doing anything but profiting off of Black people, I think it's for us to figure out ways to address the lack of mental health resources. So I've looked at a program in the United Kingdom. Thankfully, they let me complete it, even though I'm in the US, but because of COVID, it's opened up doors. I'm also looking at another program called, I'll put it in the chat here, let's see here. And I'm going to be talking to somebody about this too. CBRI, which is trust-based relational intervention for caregivers of children with challenging mental issues, because the facts show that mental health of the parents indirectly affect the mental health of children, and so affects them. And so I want to find ways that parents, even though we're going through a lot, we can still nurture our children.
Thank you so much, Angela. I think what you're saying is basically key, that, you know, starting a support group is, see, sometimes they say, you know, when you gather together, when you are alone, like one person, what can you can do something, but what can you do? A group is a crowd. Like a group, you have power. So together, so starting a self-help group, it's by no means negligible. Like it's powerful, because just being there and supporting each other as mothers going through something similar, and being a minority where, you know, I don't even want to go how, you know, Africans here or Blacks in America, they've been so marginalized, and, you know, starting from redlining, it's like we were just set up for failure, and the system is continues to be like, the structural racism and everything, it doesn't give us opportunity to flourish. I think taking that into our hands and starting something like what you're doing, it's just the beginning of bigger and better things ahead. Because when women sit together, they're going through the same thing. I'm telling you, what they will produce is powerful. It's more than what you are even saying right now. No, you will talk to women who started something similar, something just by one. Even with our host today, like she's talking, she never expected 6 years after or 7 years after to be doing this and to be flourishing. And it's bigger than, you know, the little idea that she had when she started. And with all the fears that we all have, we're human. So I can only say, you know, whatever you're doing amazing. With the women, if you can sit and start from there, nothing is small. A little bit of change can evoke something big, especially something that we're dealing with on a daily basis. So thank you for sharing that.
So I think we've really taken more time than anticipated during this question and answer session. So I would like us to go straight to the open discussion. We are going to pause the recording right now, so feel free to share tips, share your experiences that you think can be helpful to other people. It is really, we are here as a family, here to support each other. So it is something that a lot of people, even if you're not going through it directly, you know someone who is going through it. So
it was very fruitful. There's just something I want to share that I have been doing over the past 2 years, and it has really helped me to ground myself. One thing I want to say is a lot of us just live life happen. We don't have structure in our lives, and once you don't have structure, it throws things. When life throws things at you and you're not in the moment, it really affects the way you react to those things. So having structure in our lives, make sure you have a daily routine, a morning routine that is a non-negotiable that you adhere to. That's one part of showing up for yourself. Like when you have a morning routine and you do it consistently, it helps you to build character. It helps you to be disciplined. Like my morning routine is, I exercise every day, I meditate, I intermittent fast and all of that. So get something that works for you and build it, tweak it over time, and make sure you have structure, because that's one of the things that it helps you to cope with life. So that's my short intervention. Thank you.
Thank you, Zita. Truly, we need to have a routine. We can't just be living anyhow we like, thinking that life will go on well with us. We need to actually plan our life, have a routine that will help structure even our mental health. So that is important. Thank you.
I want to thank you all really so much for coming today and for blessing this time. It's been a wonderful time. I've learned so much. I made a lot of notes, but I don't think that I need to go through them now, because we have heard everything. We have heard everything from our keynote speaker, from all those we shared. It's just been wonderful. There are just 3 things that maybe I'll just give us on the way as we're going. Mental health is not madness. We grew up in Cameroon seeing anyone with mental health issues as a madman. And I think that we have carried it with us, and that is why we can't even talk about it, we can't even hear it without making it a secret or thanking someone for sharing it with us. It is not madness. So if this is the only thing you're going to take from here today, let us change that narrative. Let us start talking about it. Let us start making it normal, just like any other sickness, so that together we will help each other and we will be able to maneuver through this, because it is just a part of life. Just like COVID came and it's just there now, right? That is mental health. It's always going to be there, but if we come together and work together, we'll be able to overcome this in our lives. The second thing I learned was prevention is better than cure. We have all heard the tips from Dr. Dilys, from you all who shared and contributed so many strategies. Recognizing, you know how to recognize it and do what you need to do. And then the third thing I'm going to share is prayer is the key. Yes, Sister Tutu put it so well. Prayer gives you that hope. A few years ago, I heard about the owner of Roxypharm. Roxypharm is this big medical company in Germany who committed suicide because I think he lost some money in something and he committed suicide. And I was thinking to myself, how can that happen? How can a man who has so much, such an empire, how can he commit suicide? But when I thought about it, I just think that without judging him, that maybe losing his money was nothing else to hold on to. He lost every hope. So when we pray, when we believe in God, we have something to hold on to. And when we have that something to hold on to, that hope which doesn't die will also keep us afloat. So please don't forget, I prepared a PowerPoint presentation, but well, the Lord will want to share more. So let us just go without it. I want to say a big thank you to the organizing team of this Women's Summit. Believe me, when I started this vision, I used to do everything by myself. And sometimes I would come to the hall on the day of the summit and I would be a walking zombie because I stayed up till about 5 a.m. and woke up at 6 a.m. because I still had to do this. I had to do that. But thank God, my sisters began to offer their help. They began to make me know that I don't have to do it all by myself. And today there is a team. They are the ones who put all these things together. But for some reason, they always just like me to stand here and make noise. They are the ones who do the real work. So I just really want to thank them. I thank patience. Patience, you know yourself. I thank you so much because to be able to put something like this together, we need to put ideas. We need to have a topic. We need to brainstorm. We need to have a plan. So we need to have and Patience is the one who will always wake us up on Wednesdays. Ladies, this is the agenda, meeting time, and she will moderate the meeting, bring up the minutes the very next day, and just have everything rolling. Thank you so much, Patience. We have put these nice ideas on paper. We need to show it to the world so that you, our beautiful sisters, can know that something is going to happen and start registering. And that is where my lovely sister, Charu, she's so beautiful. Unfortunately, she's not here today, but I love her so much. Charu designs the most beautiful flyers. She's so simple. So her work is just as beautiful as her. Thank you so much, Charu. And then when we've had the flyer, we need to publicize, right? We need to get it to the places, places where the people are, where the ladies are. And that is where Mirabelle comes in. Mirabelle is the expert in publicity. You know, a few days ago, she had to send a prayer to the group because, you know, we always have to pray before this summit to make sure that God crowns everything. And she forgot to send the prayer. So I wrote to her behind and said, Mimi, where's the prayer? She said, oh, sorry, I was struggling to fill up the empty seats. And just about 2 or 3 hours later, we were sold out. So Mimi, thank you so much. Thank you so much for always being there, for all your wonderful ideas and that beautiful smile. Yeah, thank you so much. When we start registering, we need someone to coordinate the registrations. We need someone to take care of the participants. And Manka is always there. You've received her emails, right? You know, they're always so soft, so beautiful. She asked everyone today to come with their most beautiful smile. And I see your faces. You did just that. Thank you, Manka, for always being there, for documenting everything, for making our participants feel loved, feel welcome, feel appreciated. Thank you so much. Of course, our keynote speaker, Dr. Dilys. What do I have to say about her? I lack words. I truly, truly lack words. You were just mind-blowing. I've learned so much, and God bless you. Sincerely, I don't know what else to say. God bless you. And please, before we continue, everyone, whether you just stand up and just clap, wherever you are, just stand up and just clap for her, because she really deserves it. And thank you. Thank you so much, Dr. Dilys. It's been a family affair, like our MC told us before. Dr. Dilys is her junior brother's wife. It runs in the family, right? Bernardine, you have been there from day one. From the first summit I organized, you came when there was nobody except my family. You traveled from Heidelberg and you came. You've always been there encouraging me, giving me ideas, praying for me, praying for the events. I lack words. I truly lack words. You know I am grateful. You know I appreciate you. Even till today, ladies, I need to tell you, one of the things that keeps me going is my Tuesday prayer sessions with Bernardine. We've been doing this now for 8 years. This is the 9th year. We don't miss any Tuesday sessions. We have had to change days along the line, but every week we come together and pray, and it's just wonderful. Today, she's moderating, she's doing a wonderful job, and thank you, Ben. Thank you so much for being so generous with your time, with your prayers, with your ideas. You're just a wonderful sister. I really love you. I really appreciate you. I know that sometimes I mess things up and she has to scold at me. She does that, but I really appreciate it because she always does it out of love. And when I don't do something well, she tells me, Laura, that was not good. But when I do something well, she tells me, Laura, that was good. Thank you for always being there. And please, that's it from me. We might be meeting again in October, November this year, and hopefully next year we can have a live session in Cologne, Germany. So please take note of that. Bernardine, please take over the microphone and complete what you've started. God bless you.
Thank you, Lord. Thank you so much. I'm always, my God, overwhelmed with your praises, your appreciation. God bless you. I love you, and God bless you too. Thank you to all the team members, Mirabel, Patience, Manka, Ida. God bless you all as well. So I would just like us to conclude with a word of prayer. Father, we thank you for this session. Thank you, Papa, for its success. Thank you for every woman you brought here, O King of Glory. I know there's a reason why you brought them. I pray that these talks, all what we've shared here, that is going to be beneficial to us all, Papa, that we are going to use it to share with others, Papa, and it's going to alleviate us from all the stress-related issues that we are going through, King of Glory. We thank you, Papa. May your name be honored and glorified in our lives always, in the mighty name of Jesus Christ. And lastly, I would like to thank my very dear sister-in-law, Dr. Dilys. I find it hard to really call you Dr. Dilys Ngu. I will just go by Anding. My darling Anding, thank you very much. You're wonderful. You had to change your own schedule because you had to accommodate our changes. I really do appreciate you. I thank God for making you my sister-in-law. You know I love you. You know I appreciate you. Thank you. Thanks to everyone. God bless you. Bye-bye.